So I'd like to introduce the moderator of our second session, Alice Horowitz. Alice Horowitz is a research associate professor at the University of Maryland School of Public Health. A health educator, Dr. Horowitz formerly was a senior scientist at the National Institute of Dental and Craniofacial Health, the NIDCR, at the National Institutes of Health. Dr. Horowitz was instrumental in initiating the need to address health literacy in dentistry and was one of the authors of the first NIH program announcement addressing health literacy. So we thank you for that, Alice. That was a good beginning. She organized the NIDCR's workshop on oral health literacy and co-authored the resultant findings. Currently, she is co-chair of the Education Health Literacy Subcommittee of the Maryland Dental Action Coalition, a group commissioned by Maryland's Secretary of Health and Mental Hygiene, John Comers, following the tragic and untimely death of Diamante Driver, a 12-year-old boy who died in 2007 because of an untreated dental infection. She also serves as the PI of a statewide oral health literacy needs assessment study and is well known to us on the roundtable as she's presented before us many, many times. Alice, thank you.
Thank you very much, Bernie. Well, good morning again, and thank you all for being here. The purpose of this session is to explore how health literacy and care integration operate together to improve health and well-being and to lead to more patient-centered care. Originally, we were to have 3 speakers in this session, but unfortunately, Brian Hill from the Oral Cancer Foundation suffered a medical emergency related to his long-term health issues and had to cancel. Many of you probably know Brian. He is the founder and executive director of the Oral Cancer Foundation and a stage 4 oral cancer survivor. He's probably done more to raise awareness about oral cancer than any other single person in the world. We will greatly miss hearing the perspective for, as he put it, he has, and these are really, really important words, 20 years of experience dealing with the many things that fall through the cracks when dentistry and medicine are detached from what should be their common grounds. As we continue the discussions throughout the day, we should keep the experience of patients and how the system either supports or fails them in achieving their goals for health. Our first speaker for this session is Dr. Dean Schillinger. Dean is a professor of medicine in residence at the University of California, San Francisco, and chief of UCSF, General Internal Medicine at San Francisco General Hospital. He is a practicing primary care physician at SFGH, an urban hospital where he sees patients, teaches in the primary care residency program, and conducts research. Dean served as chief of the Diabetes Prevention and Control Program for the California Department of Public Health from 2008 to 2013. He carries out research related to healthcare for vulnerable populations and is an internationally recognized expert in health communication science. His work focuses on health literacy, health communication, and chronic disease prevention and management. He also is the founding director of the UCSF Center for Vulnerable Populations, whose mission is to carry out innovative research to prevent and treat chronic disease in populations for whom social conditions often conspire to both promote chronic disease and make its management more challenging. He currently directs the CVP Health Communication Program. Dean also is a co-founder of thebiggerpicture.org. You must go there if you have not yet. A social marketing diabetes prevention campaign to empower minority youth to change their conversations about diabetes and about becoming change agents of positive social change. Our second speaker is Meg Booth. Meg is the Executive Director of the Children's Dental Health Project, a Washington, D.C. nonprofit organization that focuses on removing oral health barriers to family success. Over more than a decade at CDHP, she has built the organization's policy strategy to secure pediatric dental benefits in the Children's Dental Health Insurance Program, also known as CHIP, and the Affordable Care Act. She also has led 2 federally funded national centers and currently serves as a state coach for the Centers for Medicare and Medicaid Services Innovator Accelerator Program on Children's Oral Health to advance value-based purchasing in Medicaid and CHIP. After Dean and Meg have presented, we will have time for questions. We'll have extra time, in fact. And please hold your questions and comments until after their presentations. You are now on, Dean.